So, hi Auke.
Hi.
So nice that you let me come and interview you today. Can you please introduce yourself?
Yeah, my name is Auke Ham. I am a physical therapist, or actually a master in sports and physiotherapy. I have been a physiotherapist for over 15 years now, and I specialize in dry needling, amongst other things, orthopedics, narrowed down to myofascial pain, tendon problems, physical appliances. Knee and shoulder are my main areas of work.
Okay. So I'm here specifically to talk to you about dry needling, because obviously you have been my physiotherapist and you've done it on me before. Tell me, what is dry needling exactly?
Dry needling is a method for treating myofascial pain caused by trigger points. So it's a treatment that you use acupuncture needles, but it's not acupuncture. You try to kind of disable active myofascial trigger points, and myofascial trigger points are responsible for referred pain in the body. So that's what you do.
Okay. Well, can you define a little bit what a myofascial trigger point is exactly?
Yeah. In Dutch, the people like to talk about knots or lumps in their muscles. In muscles, you can feel taut bends. They are, if you go through a muscle with your finger, you always feel one or two taut bends, and in that muscle there are always a few points that are tender points. Those tender points are usually trigger points. The trigger points can be either active or latent. The latent trigger points you don't need to treat them. The active trigger points usually cause pain elsewhere in the body. So it can be that you have a trigger point in your shoulder and you have pain in your arm. Usually it's that way around. So it's the trigger point is close to the body, and referred pain is more peripheral.
Okay. So if I come to you with a pain in my hip, for example, it could very well be that the cause of it is actually somewhere else in the body that you need to treat, pretty much. Yeah.
Usually in the back or the surrounding muscles.
Okay. Okay. So how does this differ from conventional therapy? So first of all, what is conventional therapy for these kind of pain?
There are a lot of treatment modalities. We used to have massage as one of the biggest therapies in physiotherapy. There's of course exercise therapy. You have taping. Nowadays we have shockwave, which is over there. We have conventional trigger point methods, which are for instance, trigger point massage, but frictions, so very local. What could we do more? Mobilizations, that sort of things.
So
stretching.
Stretching. Okay. And also probably doing specific exercises on the machines in the gym or something as well, right? I guess.
Exercise therapy.
Exercise therapy. So how is dry needling better than all of those therapies?
Dry needling isn't necessarily better. It's different. Everybody requires a different approach, and every modality is good for something. I think you need to be sure what you're dealing with. So first of all, you got to get your diagnosis straight. If you have a hip arthrosis, dry needling might not do so much, because if the pain is really coming from the arthrosis, you're done. But if you have an arthrosis or an arthritis and the muscles spasm as a result, then you can do dry needling to make it more bearable, for instance. Then if there's a real good indication that you should use dry needling, which is myofascial. You can use massage and stretching, and because it's all influencing muscle tissue. The only difference between the dry needling and the other modalities is that you can get much deeper. Massage only gets 3 centimeters deep, and you can use needles up to 10 centimeters long, depending on the person, the muscle, and the area that you're working in.
Wow. Okay. So how do you diagnose, a pain, whether as a referred pain or something that you can dry needle? Like, what are your parameters that you use to determine whether to dry needle somebody or not?
Every patient that walks in here, I start with a first diagnostical conversation, and then we discuss what the complaints are, which gives you an idea of what it is and what it isn't.
Yeah.
And the last part is very important because you have knowledge about the area that the complaints are in. You have different pathologies, and you begin with excluding them. At the end of the conversation, you have a few pathologies that are left, and you do a physical exam. It's as easy as that, and you can cross off another few pathologies. What you have left is a final diagnosis, or you have a question about the diagnosis and you need to do some more research, which could be an X-ray or an ultrasound, depending on the problem. A medical diagnosis usually doesn't involve myofascial pain, because if you put someone in an MRI or under an ultrasound, you can see the trigger points. Nowadays you can, because it's very tiny and it's very hard to see, but you can. And but you cannot connect the trigger points to the pain with an ultrasound, for instance. What you really need to do is look at the surroundings and then palpate the trigger point. If you palpate it and your patient experiences the referred pain, you're absolutely 100% sure of your diagnosis, and then you can needle it for sure. It doesn't always work like that because it's not that black and white, but that's
cool.
About it.
So how permanent are the results? How often, and if not permanent, then how often do patients have to come back?
You usually do the treatment 3, 4, maybe 5 times, depending on how long the complaints have been there. Because if a patient has pain for years, you cannot really suggest that the pain will be over in 2 or 3 weeks' time. Although sometimes you have miracles. But usually the dry needling should take 2, 3, maybe 4 or 5 times, so that's it. And then the results should be permanent. And I say should be because there are some factors that are to be considered. If somebody has joints that are arthritic, or then you have factors that can still keep the myofascial pain coming back, and then it could be that you see patients on a more frequent basis, or you treat the cause first.
All right. Is there something that patients can do to ensure that the treatments last, a longer time? I mean,
Yeah.
what do they have to do to take care of themselves in the meantime?
Well, the most important thing is a healthy lifestyle. That goes for every health question. So, what's your eating habits and your drinking habits? Make sure you eat enough vegetables, but exercise is very, very important. always after the myofascial treatments, or usually you give stretching exercises as well, because you can keep the muscle tissue well in length, and you stretch the myofascial trigger points as well, which is also a very good method for deeper problems, but it works slower.
So the other question was, is there any instance where dry needling should definitely not be used?
Yeah, there are a few instances where dry needling should not be used. I've written them down because it's a rather long list, or well, maybe not, but
Well, just give us an example.
you have counterindications there. At least if you have a bloody disease. So if you have a problem with when you have a wound and it keeps bleeding, even if you temper it, that's patients know that. And there are relative counterindications, such as a fear for needles, or edema, or pregnancy.
Okay. All right.
But I've written a long list down as well, because bacterial endocarditis, a diseased immune system like HIV, are all diabetes, epilepsy, allergy for metal, different kinds of medication, so also bloedverdunners.
Blood thinners.
Blood thinners. There are implants, that kind of things.
Okay, all right. So that's great. Thank you very much for that theory. So I was hoping for a live demonstration, but you're probably going to demonstrate on me.
Yeah, I don't see
So
anyone
first
else
of all-
around.
Yeah. Well, shall we? First of all, can you let us see what the needles look like?
Yeah.
Actually. Okay. So show us the tools of the trade, Auke.
Well, I got a few different sizes of needles here. These are the fun ones. And it goes all the way down to, I've got 1.3 centimeters as well. This is 2 centimeters. No, it's 3 centimeters. But it goes all the way down to a few millimeters. And these are 10, I guess. Yeah, these are 10 centimeters.
So okay. So can you give us instances in which each of those needles are actually used?
I use the 5 centimeters the most. The 5 centimeter needles are well, very well handleable, and usually enough. You don't have to use the whole needle, you can use just 1 centimeter of it. Most of all, you ensure safety of the patient,
Yeah.
which is the most important thing throughout every treatment, but especially when you enter the body. This is a 10 centimeter needle, so this is the handle, or the bar, and this is the needle. The needles are very flexible, as you see.
Hold on a minute. Yeah. Go ahead. Can you do that again, please? Yeah.
They're very flexible, so they don't break off. They're unbreakable. You can see
Wow.
they're still intact. So it's not possible that if I put them in your body, that part of it remains there, which is nice for me. Doesn't look good on your resume. Well, this is the needle I use most. The acupuncturist will probably use more this kind of needle, because it has a steel handle, and these are the rubber handles.
Yeah. Okay.
So they're stuck to the tube.
Yeah.
And normally, if you inject them on me, I don't have to be sanitary, because I'm very sure these needles are sanitized. But on my patients, I will do that. Of course, I will do that differently. And you tap them in. And they're
Ooh.
And you see that there's a slight piece of the needle already in the fascia. And now you see it moving.
Amazing. I have, of course, seen this done on me, but I have not actually watched it being done. It's fairly uncomfortable, I can tell you.
fear of needles is a relative constraint.
Absolutely. No, I agree. Very cool. So, what is your success rate? I mean, if you would look at your how many, more than 10 years of experience with dry needling, what would you say that your success rate is?
You really, I'm not really sure.
Hmm.
We have in our practice we have what we call the prompts. We keep track of how people think we are doing, which is not actually described in pain or being treated for a complaint and having no problems at all anymore. But I can tell you that we have an 8.7 average, so that's out of 10.
Okay. Yeah.
And we have a 70 net promoter score, which means that 70% or no, 70 patients out of 100 are actively telling other people to come to us.
Yeah. Yeah.
Which means it's a pretty good score.
That's really great. Well, I am one of those patients because, you have dry needled me many times, and I definitely have seen an improvement in my pain levels. So, and obviously it is a technique that really works.
Yeah. I've got some references as well that it works at least as good as the version of other therapies. So.
Okay, well, those references will be in the post on We Talk Science. Thank you so much, Auke, for your time, and I appreciate it. And, I'm not going to watch you do that again because that was very uncomfortable. Thank you very much.
You want me to show it on you?
No, thanks, it's fine.